Federal Medicaid cuts from the Big Beautiful Bill Act passed last year will begin taking effect this year. In this week's Health Link, King 5's Christine Pei examines how the cuts could impact a groundbreaking opioid addiction treatment program in Seattle.
It's a scene that plays out regularly across Seattle. Emergency responders rushing to an overdose call. A pilot program launched 2 years ago has shown promise in alleviating the problem.
We're trying to get there in that moment as someone is with our team, waking up so that we can kind of jump in that moment and offer, just a gentle wake up.
Jessalyn Haynes is a UW Medicine nurse practitioner embedded with the Seattle Fire Department's mobile integrated health program that has taken on a unique approach to treating an overdose. Centered in the treatment plan is buprenorphine, an FDA-approved medication that stabilizes patients and protects them from future overdoses.
Someone receiving Narcan, it often pushes them into withdrawal, and it's very uncomfortable. People are pretty miserable with those symptoms, and buprenorphine can help alleviate that.
Patients are given buprenorphine immediately after an overdose without necessarily stopping fentanyl use and experiencing withdrawal.
Well, a lot of it is trying to reach patients where they are, when they need treatment, when they want treatment, and being able to bring that treatment to them rather than expecting them to come into a clinic or a treatment program.
The efforts appear to be working. Public Health Seattle and King County data shows overdose deaths in King County went down from 1,340 in 2023 to 917 in 2025, according to dashboard data. But Dr. Jared Klein, an addiction physician and medical director of Harborview's downtown programs, says that progress could be reversed if there are significant cuts to Medicaid.
The issue is going to be both an impact potentially on the availability of these treatments for opioid use disorder if the state doesn't have the capacity to pay for some of the medications, especially the newer injectable medications are still quite expensive.
HealthLink checked with Washington's Healthcare Authority, the state agency that oversees Medicaid in the state, also known as Apple Health. HCA says it is still assessing how federal cuts will specifically impact the state's opioid use disorder programs and that it will do what it can to mitigate impacts. But any cuts to Medicaid coverage could result in fewer federal funds in Washington state and increases in uncompensated care, which could affect opioid treatment providers.
I think it would be frankly devastating to the individuals that need this treatment and to the broader community.
While the cuts wouldn't directly impact fire department funding for overdose response, they could limit where responders can connect patients for ongoing treatment down the line.
We can offer buprenorphine in that moment, but the key is these resources that we can connect people to.
For HealthLink, I'm Christine Pei.